New migrants are less likely to be vaccinated than the general population in England. This is because vaccines given to migrants in their country of origin may be different to vaccines given in England. The same vaccine may also be given at different ages. Migrants can find it hard to access vaccinations because they are on the move and may experience language or cultural barriers when using healthcare services. They may also worry about paying for vaccines. Keeping up to date with routine vaccinations is important for the health of migrants and their children. It also helps to prevent outbreaks of diseases in the community. Some migrants have a higher chance of suffering very serious illness from infections or have a higher chance of catching certain infections. These migrants should be offered extra vaccinations to protect them. This can include vaccinations for hepatitis A, tuberculosis, and additional doses for hepatitis B. Migrants may also need travel vaccinations before they go overseas to visit family and friends. In England, NHS primary care, including most vaccines, is free for everyone. This includes migrants, refugees, asylum seekers, and overseas visitors. Migrants should register with a GP as soon as possible. It is not a requirement to provide proof of an address or proof of identity to register at a GP practice. It is helpful to do so, and patients will be asked to provide documentation if they can. Likewise, there is no requirement to provide proof of immigration status. This applies to everyone, including asylum seekers, refugees, people who are homeless or just visiting from overseas. If patients cannot provide any documentation, this is not a reason to be refused registration. If homeless, patients can provide a temporary address, which may be a friend's address or a day center, or even the GP practice. Migrants do not need to pay for routine vaccines. Most extra vaccines, or testing and treatment for blood-borne viruses and sexually transmitted infections. They may need to pay for some travel vaccines. Migrants can get more information on how to access GP services and vaccinations in a leaflet created by Public Health England. It is available in multiple languages. You should check the immunization status of your migrant patients and their children. If you are unsure whether they have received all the recommended vaccinations in England, you can use Public Health England's tool for vaccinating people with uncertain or incomplete immunization status. You can also use the Immunization Schedules Comparison tool to compare England's vaccination schedule with other countries' schedules. Migrants should also be offered the COVID-19 vaccine for free. The same COVID-19 vaccine prioritization rules for the general population in England apply to migrants. Information about COVID-19 vaccines is available in multiple languages. It is never too late for migrants to catch up on vaccinations to protect them and their community from infectious diseases. For further information, visit the Migrants Health Guide page on immunizations.